We have a couple sound bites here from President Obama, who's out there at the town hall at AARP headquarters. And by the way, Andrea Mitchell, NBC News, Washington, when she introduced the show, she actually said Obama was appearing before a willing audience. A willing audience. That's an interesting way to describe a bunch of people that have been picked and chosen and screened. A willing audience, as opposed to people who don't want anything to do with this. So we have these two sound bites. Let's see. New wrinkle he rolls out here. Listen to this.
We also want to start rewarding doctors for quality, not just the quantity of care that they provide. Instead of rewarding them for how many procedures they perform or how many tests they order, we'll bundle payments so providers aren't paid for every treatment they offer with a chronic to a patient with a chronic condition like diabetes, but instead are paid for how are they managing that disease overall.
Oh, no, this is getting worse by the day. Now Obama and his panel are going to judge the work of the doctors, not just the quantity. They're going to determine whether or not the doctor did the proper number of tests and handed out quality care. My gosh, folks, this is becoming more and more Orwellian every time this man opens his mouth about it. We want to start rewarding doctors' work. They get paid. What is this reward business? Who are you to reward them anyway? Who the hell are you? Your career has been 5 minutes. You spent 150 days working in the Senate. You organized riots and communities and stuff in Chicago. And he's now going to run the medical business and appoint people to determine how well doctors are doing their jobs. Listen to that. Play that soundbite again. Play that soundbite again. Play that soundbite again.
We also want to start rewarding doctors for quality, not just the quantity of care that they provide. Instead of rewarding them for how many procedures they perform or how many tests they order, we'll bundle payments so providers aren't paid for every treatment they offer with a chronic to a patient with a chronic condition like diabetes, but instead are paid for how are they managing that disease overall.
How would you know? How in the world would you know? Bundle payments so providers aren't paid for every treatment they offer with a patient with a chronic condition like diabetes? What's the question? The official program observer has a question. What's the question? Well, that's a good question. The program observer has just asked me, some patients are lousy patients. Some patients refuse to cooperate. Some people with diabetes go in and get the insulin shot, think they can have a piece of cake and a bowl of potato chips or what have you. And then, not long, they're on dialysis. Well, I can answer this question for you. You are going to be denied coverage if you aren't trying to help do the right thing for yourself. You are not going to be treated. You're going to be deemed too expensive. The investment in you is not going to be worth it. Where else can this possibly go? With just listen to this one soundbite. If I'm a doctor in this country and I hear that, if I'm one of the 40 willing people at this put up phony seminar today, and I hear this man who nobody knows. We know more about his friendship with Skip Gates than we know about his 5-minute career, is going to sit there in judgment of the quality of the work doctors do. I can't wait to listen to this next soundbite.
Here's a guarantee that I've made. If you have insurance that you like, then you will be able to keep that insurance.
Nope.
If you've got a doctor that you like, you will be able to keep your doctor.
No.
Let me also address, I think, a misperception that's been out there, that somehow there is any discussion on Capitol Hill about reducing Medicare benefits. Nobody is talking about reducing Medicare benefits.
Yes, they are.
Medicare benefits are there because people contributed into a system.
It's bankrupt.
It works. We don't want to change it. What we do want is to eliminate some of the waste that is being paid for out of the Medicare Trust Fund that could be used more effectively to cover more people and to strengthen the system.
Next, he's going to do a seminar on how to build a bubble car. And he's going to sit in judgment of the people that do that. There are cuts in Medicare. Heritage has found them. Let me tell you something else, folks. At his press conference last Wednesday night,